back in Malaysia, pursued her career in pediatrics and obtained her master's in pediatrics from University Malaya in 2011. And she was in University Malaya Medical Center as a pediatric specialist and lecturer. She's currently registered general pediatrician in our NSR and a life member of MPA. In 2014, she decided to venture into private practice, and she has wide clinical experience in general pediatric health issues and special interest in child learning difficulties, child psychology, and parenting issues. So she'll be talking to us today on overcoming vaccine hesitancy among parents.
Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon. I have to agree with you that the light is very bright. So good for me. I don't have to look at your faces. I hope that I will try to make it short and sweet so that we can enjoy our dinner after this. So I'll be talking to you on overcoming vaccine hesitancy among parents. I bet all of us, whether we're in public setup or in private setup, we do come across a number of parents who are actually hesitant to giving vaccine to their children. Yeah? And this had been happening. I've been in private practice for the last 10 years. I would say that even in the first year, I've been having to deal with this group of patients. So we know that vaccination is the world's safest method to protect children from life-threatening diseases, and one of the most cost-effective health investment one can have. And we use vaccination as a vital tool in the battle against antimicrobial resistance. And we have over and over again evidence that vaccination works. However, we still hear about reported cases of vaccine-preventable diseases globally as well as locally. So this is a report by WHO. Up to 2021, there's actually high cases of re-emergence of vaccine-preventable diseases like diphtheria, pertussis, measles, tetanus. Yeah? And if we look at the global vaccination rate at this time, the latest report mentioned that 1 in 5 children globally do not have access to essential immunizations. And this lack of access to vaccines leaves children at risk of death, disability, and illness from preventable diseases. In 2021 alone, global immunization coverage actually dropped for infants to only 81%, and this is the lowest rate in over a decade. So this is during the period of the pandemic, COVID pandemic. Malaysia introduced our national immunization program in the 1950s, and up to now, we had already have about 13 vaccine to cover against vaccine-preventable infective diseases. So, and we actually have one of the highest vaccination rate in the country. If you compare to the rest, we have actually cover at least 90 to 95% for our basic vaccination. If you look at this slide, you can see that it is, if you look at measles containing vaccine first dose, coverage is at actually 96%, if you look at this side. But it's a bit funny that the second dose is only 84%. I can't seem to find what's the reason behind it. Because our measles vaccination, we've been giving from 9 months and a booster at 12 months. So it's not really a long period. In those days, we used to give at 12 months and then later in school standard 1, right? So I can sense the possibility of dropout, but when you give it at school, there's, you know, it will actually secure the rate. But this is a bit something interesting on why there's a drop in this rate. All right. Okay. So as what we mentioned earlier, during the pandemic period of these 3 years, the new UNICEF report actually shows about 67 million children had missed out on 1 or more vaccination over the 3 years period. And these are due to service disruption. caused by strained health systems and their version of scarce resources, conflict and fragility. But what they found in this report also, there's actually a declining confidence in childhood vaccine. Okay, and some countries up to 44 percentage point. And now we are looking at this period of pandemic actually had led to a major backsliding on childhood immunization given to these children. 23 million children missed out on basic childhood vaccines through routine health services in 2020. And this is the highest number since 2009. So what are the main reasons of them not receiving vaccine? There are two main groups. One is those who are under-vaccinated, and now we are seeing an increasing number of vaccine hesitancy among parents. But we need to understand what's the difference between these two. I know I'll be talking more about overcoming vaccine hesitancy, but there are also globally, there's a group of children who are not being vaccinated because of the parents' lack of awareness or education about vaccine itself. The vaccine are not available or inaccessible due to either poverty or deprived socio-economic status. There's an ineffective national immunization program, lack of resources or weak public health infrastructure. And of course, during the pandemic, everyone stays indoors. Everyone's scared of the hospital. Even personally, people are scared of doctors. When you look at this increasing number of vaccine hesitancy parents, is mainly in the areas where vaccine is easily available and accessible at personal and national level, and it is mainly due to parents' personal choice. So what is the definition of vaccine hesitancy? As given by WHO and the SAGE working group, it is an act of delaying the acceptance in completing their vaccination and refusing vaccination despite the availability of vaccine and vaccination services. In 2019, vaccine hesitancy had been deemed as the top 10 threat to the global health by WHO. And we had recognized that this is a problem as early as 2013. In this paper by Alias et al. In 2020, so they look at the trend of cases in the government health facilities, and they see there is an increasing rise in the number of vaccine hesitancy cases in the government setup. And we know that there are more in the private setup. I don't have the numbers though, but I think personally we do. And I've been to different private setup, and there is this form where the parents can actually say that, I wish for my child not to be vaccinated, and they are to sign the form to say that, that they requested for it, and so as a documentation, right? So if we can go through that just for the first dose of hepatitis B and BCG, we'll probably be seeing this more number of vaccine hesitancy or delay, right? In this paper, what they see is the main reason for vaccine refusal are mainly the usage of homeopathy and traditional medicine, either as a preventer or as treatment. There's a lot of issue with halalness of the vaccine because in Malaysia, JAKIM does not bring out any certificate of halalness for vaccine, unlike certain other overseas countries, right? And of course, the content of the vaccine itself, I think pertaining mainly on the safety issue and long-term effect. So to know how to overcome vaccine hesitancy, we need to understand the factors that might influence the parents' decision to vaccinate their child. And it comes in 3 different factors, and it actually influences each other and intertwine there. So one is the parent-specific factor, which is the person himself, the parent himself. And this can be due to their own background, in their cultural background, in terms of their religion background, education level, income, their knowledge about vaccine, or they perhaps have certain kind of past experiences with vaccine, either positive experience or negative experience. Then comes the vaccine-specific factors, how the parents perceive the vaccine efficacy as well as safety, and also how they perceive the disease susceptibility. most of the time if they see that, I don't see measles anymore, so why should I subject my child to MMR? Or they have this perception that MMR causes autism, then I don't see measles, why should I give, right? So how they perceive the disease susceptibility is also another factor. And then comes these big, huge external factors that what we are actually, it's easy for us to educate them about the vaccine, right? We come in a multicultural country, and we are so used to all Malaysian, perhaps we'll be able to handle the parent-specific factors. But in terms of external factors, this is where we actually play a role. There are studies that actually showed that the relationship between the parent and the caregiver and the doctors, us, actually are the main factor that can really influence the parents' decision on whether to vaccinate or not. And it's because of their trust in us. Okay? So the moment that they come to us, the fact that they come to us, even when they are a bit hesitant, they ask a lot of questions. And if we are able to alleviate their issues, to alleviate their concern and anxiety, and develop this trust, we might be able to nudge them into accepting vaccine. If the school have this clause where there is immunization requirements before attending school, that might actually nudge them to accept vaccine. Sometimes, being people of the society, we look at social norms. That's another external factor. If our neighbors, if our community all get vaccinated, majority will just follow the norm. The other two external factors which I think is very important is the policies that our government made and how we actually address this policy, how we actually introduce this policy. Because sometimes, people's perception about government then is more of how the government is supposed to be able to approach them and to educate them about the policies made. And this is the one that we usually handle, media. Okay, there's a lot of misinformation out there. They get a lot from the internet. Sometimes certain myths that you never heard of. This is what I've been talking about, and I hope that it gives you some idea about how to handle misinformation and myth when they come to you, to your clinic, and asking questions. Okay. If you look into the parent specific factor, I spoke about in terms of cultural, what the cultural think about vaccine, or even religion. A lot of people talk about religion belief and all that, but there are studies that actually, when you look into that, it's not really about the religion itself, it's not really about the culture itself, it's actually in terms of the person and how they look at, how they actually look at certain subject or certain things that brings them about to making certain decisions, especially in terms of making choices in terms of medical terms. So vaccination acceptance is a behavioral outcome. It results from a complicated decision-making process that, as we know, impacted by a variety of variables. So WHO and SAGE working group model had come up with this 5C model: confidence, complacency, constraint, calculation, and collective responsibility. So what they do is they also include psychological variables, because you're dealing with a human being who's supposed to make such decision. Okay? So when we talk about confidence, it's confidence towards their healthcare provider. How confident are they to us? Can they trust us to inject? Do they trust us with the information that we're giving? If they trust us, they probably would just allow us to do what we need to do. Second is confidence towards the vaccine. Pharmaceutical companies, is it safe? Is it really efficacious? Is it really a need? Third is confidence to the government, making this policy and deciding which vaccine is right for the people. So we need to gain their confidence. Okay? So once they have the confidence, then we might think about, then they will be able to make that decision. Number two is complacency. As I mentioned earlier, where we had quite good coverage in terms of vaccine, and we hardly remember, I think about 10 years ago, we probably don't see pertussis that often. At one point, there's a drop in the DTP vaccination uptake, and then we have the re-emergent. So complacency, when they don't see there's a threat, they feel there's no need. Another example is COVID-19. So when the COVID-19 came about the first 2 years, everyone wants to get vaccinated. Hence, you need to have the armed officers to bring the vaccine in, right? Because there's a threat, and so they feel there's a need. But now, I don't know what's going on. Now everyone's like, nah, it's just like a simple flu. It doesn't really work. I might as well spend it somewhere else. Might as well do something about it. So they become complacent. And it is our duty to actually to educate them that why you are not seeing the cases is because we are having a good herd immunity. That's the reason. Okay? Third is constraint. Constraining is more of the person. I would say in Malay, banyak alasan. Okay? When we make things easy, it should be easier for them to get it. For example, what our government is doing is that we are giving the vaccine for free. We have it all over the clinic kesihatan. They are giving proper schedule. But they might come out with things like, oh, I have to take off work. Means that I might need to spend more money to get to clinic kesihatan or the clinic. I have to spend hours waiting in line. Parking is difficult and things like that. So that's what it meant by constraint. So if only we can actually go to their house and just do like you're due today, park. Like antenatal, postnatal checkups, like what our GM is doing. But I don't think we can do that. And people need to understand and be educated the importance of this so that they feel easy. That okay, we have it here, come get it. Okay? Number 4 is calculation. And this for those parents who are very analytical. And they do their own risk calculation in their own ways. So this group of parents are the type that will actually look for facts. They don't really believe in myth and all that. They don't like to hear hearsay, but they look for facts. And hopefully they get the proper facts, the correct facts, so that they can make that decision. The final C is collective responsibility. I remember during COVID-19, we talked about social responsibility. Please wear your mask, please wash your hands, take care of each other. Even if you get COVID, just wear your mask, stay indoors. You are playing your role as a society. Same as collective responsibility in terms of vaccine is that understanding herd immunity and our background as Asian is that we always feel that we not only take care of ourselves, we take care of our community and our neighbor. So if a person have that sense of social responsibility, then they are more likely to incline to get their children vaccinated. But if you have someone who is a bit antisocial, they might not care. So this is a person himself, like, I'm fine, I don't care. As long as my family is okay, I don't care. You guys go get it, I'll be within the herd immunity kelompok. 95% of people around me are vaccinated, I'm fine to be the 5%. So this is a bit challenging, because I think most of us actually had met with one of these parents in our clinic. Okay? So it's important to understand where they're coming from, because there's so many different people with different background, with different knowledge and interpretation of what they think is necessary. So we cannot be handling vaccine hesitant parents the same. It should be dealt individually at our level. Okay? So there's no such thing as, we used to call pro-vaccinator, anti-vaccinator. We no longer call that, we call them pro-choice. They have a choice. We have to respect the fact that they have the autonomy to make the choice. But we hope that they have enough information, and then if they have enough information and they have all the facts, they'll probably be more inclined to become a vaccine acceptor. So it's actually a spectrum. From one end, a vaccine rejector, these are the ones who are fixed on not giving their children vaccine. And mainly, the children will be unimmunized, completely reject vaccine, including vitamin K, if you notice. They have very high safety concern, they shut you off, you can't even talk about vaccine with them, and because of the lack in trust in healthcare provider. Sometimes you wonder why you come knocking at my door. Okay? But it's just that because they want you to check certain things to confirm what they feel and then they walk off. And I do have a few families actually who are total vaccine rejector, but they still follow up with me for other things. Sabar. I remember I had chat with a group of colleagues who are saying that if they reject what we plan, can we reject seeing them? I mean, we have our own autonomy as well, right? But I feel that it's not the child's fault. I felt that it is not, I mean, their decision in one point, but the other part of the child, I think, as a pediatrician, I think we should actually at least monitor. And hopefully one day they'll change. Out of, I think, three patients of mine, 3 different families who are vaccine rejected under me, after 1.5 years, suddenly the father asked me about, do you think we should vaccinate them? And this is because the child keeps on coming in sick. With influenza, the child had rotaviral AGE, the child had chickenpox, and also underlying asthma and things like that. The father just asked that one simple question, and I'm like, opportunity. But then the wife looked at him, and he kept quiet, so I let them handle their own issues first before we push it. And then you have the vaccine acceptor. These are the easy one. They walk in, we say, okay, your child is due for vaccine today. They say, do whatever you want. Whatever is on the list, doctor, please give everything. So sometimes I have to put on hold and be like, you need to understand what are the rules for each vaccine, and we plan out, and if you're agreeable to that, then we do one by one. They have very few concern about vaccine, and they have very high trust in us as healthcare provider. What we'll be talking about mainly is in the center group, the green group there, vaccine hesitant. And because there's a lot of doubt, there's a lot of question about vaccine, the safety, efficacy, and sometimes they select only certain vaccine. Sometimes they decide, I would prefer to delay until they go to school, and there is always this desire to find the most trustworthy healthcare provider because they're still searching. They probably jump from one doctor to another. Okay, so these group are the one that is more susceptible to influence. Okay? I'm not saying that we should be manipulative. I'm just saying that we should be open. Okay? So, yeah. So healthcare professionals, we have an essential role in promotion of vaccine acceptance. So, I check up like, sorry, yeah, I'm finishing soon. So now we're talking about how can we approach them. Okay, so there are these 5 promising approaches on how we, the healthcare provider in clinic setup, can communicate to the vaccine hesitant parents. I'm going to go through it one by one. We're talking about addressing myth and misinformation. I do see, since a lot of people are active on Facebook and doing Facebook Live, we know that managing myth and misinformation about vaccine is very, very challenging. Sometimes it can be very frustrating as well. It just takes a toll of your clinic time, and there are times you wish that, why come if you're not going to get it anyway? So, but I do find that sometimes addressing myth and misinformation by refuting them with facts. So you answer myth 1 and the facts against it, myth 2, second, 3. It actually doesn't work. And there are papers, there are published papers to say that actually it can be counterproductive. And it may have a boomerang effect in which they may not change their mind or going to push them into becoming vaccine rejected. So what we found, what the paper found now is that it is much more productive instead of spending time talking about or refuting the myth and the misinformation is to pivot the conversation and talk about the disease risk itself. Just talk about the disease. No need to talk about the myth because you know that they won't listen. They have come with all sorts of ideas and they just want to test you to see whether you're going to falter or you're going to sometimes, They just want to see whether they can tickle you a bit there. So the best is actually to stay calm and just pivot the conversation to disease risk. What's the aim is actually for that individual, that parent, is to perceive that their child is at risk of the disease. When they perceive that, yeah, my child can be at risk of the disease if the child is not vaccinated, and that they believe that there is an effective action, is to vaccinate. Okay? And then when they listen, when we talk about disease risk, we're not just talking about how sick they're going to get, things like that. We're going to also talk about how vaccine going to help, right? But then they will gain confidence to take the action themselves. So it's like we don't make that decision for them. They realize it and they're going to change their mind, and hopefully nudging them into become vaccine accepted. Second is to give a strong and personalized recommendation. Mainly is communication skills. Okay? Our clinic, we don't really have time to spend on them. Sometimes one parent can come multiple times and we're talking about the same thing and they keep on asking the same question. Yeah? But it is actually the consistency of the information that we give and the strength of the recommendation that we give to them. And if they are confident with us, they might be. If they come to you on the day that the child is due for vaccination and they have all these questions, answer them, listen to them, and encourage same-day vaccination because they're already there. But sometimes they might go and say, yeah, we'll come back in 1 week's time, they might not come back. So we'll try to take, we're not forcing them, but we will prefer that, they decide, yeah, okay, let's have the vaccine today. And as I mentioned earlier, provider recommendation is one of the best predictor of vaccine receipt among various adults. So it is what we say and how we convince them actually will be, is actually one of the best. Okay. Number 3 is to use presumptive communication to make vaccines a default behavior. So when they walk in to the clinic and the child is due, they know that the child is due for vaccine. They don't just come to your clinic not knowing what's going to happen today, right? I mean, we would have told them, okay, you're coming in next week or you're coming in 3 months' time for whatever vaccine. They can't come in pretending not knowing that the child is for vaccine. We made it as a default behavior. It's like, okay, good. How's the child? Child's well. You are due for vaccine. I'll go prepare the vaccine. Instead of, by the way, you remember we talked about vaccine. Perhaps we may want to do 2 vaccines today. How do you feel about it? How do you feel about 2 injections today? So they might actually take a few steps back and they start asking you questions, and then your clinic will be like, okay doktor, sakit tak doktor? Demam tak doktor? Nak pergi cuti, nak balik kampung, boleh ke doktor? So that kind of one is not, I mean, it just takes the time out of your time, can be very frustrating as well, and we might, they might miss a jab. Okay? The other example I can think of in presumptive communication, it's not really communication per se. In the private setup, we have package, right? Delivery package. So in the delivery package for newborn, usually we straight away will put there, including vitamin K, hepatitis B, BCG. So it's something like a default thing that all newborns will receive this injection. So unless they say otherwise, they'll be automatically given. But there's something that for them is like, okay, have you given the vaccine because I paid for it? Okay? So that's another thing. Okay? Oh, the other thing about this part, I talk a lot about private setup is because nowadays a lot of our patients tends to go to clinic kesihatan. So they deliver with us and then they tend to go to clinic kesihatan for the vaccination. I find that when we say, so would you prefer to come back or would you like to go to clinic kesihatan after the first week postnatally? A lot of them are not sure. And I find that sometimes when they come at 2.5 months later, they say, yeah, I'm just wondering about the vaccine. How about am I supposed to get it? And that you're lucky enough that they suddenly remember, oh, this baby is actually due for the first jab. So I've changed my ways. I'll just automatically, everyone gets an appointment. Whether they come or not, the reminder, when we call them for the appointment, you're due to come today for vaccine, it's a reminder for them to know that, yeah, the child is due. So if they decide to go to clinic, then at least they've been reminded about it. Number 4 is to apply motivational interviewing to nudge them towards acceptance. This motivational interviewing, it focuses on leveraging the individual's intrinsic motivation for deciding on certain things. In this context, on deciding to vaccinate or not. It takes a bit longer time in clinic. There's a lot of active listening, reflections, giving open-ended questions, and also asking permission to provide additional information. Sometimes shoving them with information might actually push them away. So it's always good to have this laid-back kind of conversation with them, so that and acknowledging their autonomy there, so that they felt that, okay, we are actually strengthening the perception that we are trying to work with them towards the common goal, which is for the health of their child. So when they feel that we are working together and understanding them, then we can nudge them towards acceptance. And finally, we should be tailoring messaging to increase the salience of vaccine, where we match each individual's specific beliefs and attitudes and experiences to the message or the information that they provided. So if, for example, they talk about their worries on MMR, autism, is still going on. I can't believe I've been talking about autism and MMR so many years, and it's still out there because we can't take it out from the internet. Then sometimes it's not because of that. Sometimes they may have other beliefs or other experiences that we do not know. So it's okay to listen to them, and then we provide them the information pertaining to them. Okay? So this will improve relevance of the information. The other thing is, when we talk about, sometimes they just ask about certain vaccine, about safety of vaccine, side effect of vaccine. I think common side effect is common. We talk about that, but not so common, 1 in a million kind of side effects. Don't highlight lah. You highlight them something from 1 in 100,000 cases, you get this and that. They won't hear other things. And that's it, they'll be like very hesitant, or they will try to delay. Additionally, personalized recommendation through the provider's own experiences in decision-making process may actually help. May not be our own decision-making, but how we have other parents make that decision. A lot of parents like to ask me, would you give your own child? Or they ask, would you give your own? I don't have a child. So they say, would you give your own niece and nephew? I say, yeah, they all get vaccinated. They're fine. They're okay. So that sometimes actually helps, because they know that I care so much about their child, we caring more about my family. That actually helps to actually nudge them to accept this. So the take-home message is, vaccine hesitancy is a global and local health threat. I think we don't talk much about this in Malaysia. I think we are aware about it, but now we should be working more towards combating this. It can undermine the effort by the National Immunization Program to reduce the spread of vaccine-preventable diseases. The factors of vaccine hesitancy varies and very unique to each individual parents, to identify it and approach them individually. And us, the healthcare professionals, play an important role to educate parents and promote vaccination. Thank you.
Thank you, Dr. Sharifah. I mean, for me, I think you'll be there, and I can just share from here. Any questions from the floor? Any questions about vaccine hesitancy? How do you tackle your patients in your day-to-day care, both for pediatricians and also general practitioners?
Thanks, Dr. Sharifah, very nice talk. I have 2 questions from the vaccine manufacturing perspective. There are so many reasons of vaccine hesitancy. Is cost of vaccine a factor in barrier to vaccinate or hesitancy?
Cost of vaccine? Yes. But in Malaysia, they have an option to get the basic immunization from the government setup, which are free. So those who are, but when you talk about taking optional vaccine, then they probably be. So, but then, having said that, if the parents are concerned and they know that the disease burden, if the child gets infected by certain diseases like influenza or rotavirus, they will work for it. They will get it. Yeah.
The second question, you mentioned halal, non-halal, halal issue and the content issue is a bigger concern. In one of the papers also showed that. As a vaccine manufacturer, how we can address that concern? I mean, and regulators don't allow you to claim halal on vaccine or any pharma product. So how you address that, and what do you recommend as for a manufacturer to support pediatric practice or address this concern?
We know about although there is no certificate from JAKIM locally, the Majlis Fatwa actually had mentioned that the vaccine is actually, there is a, what they call it, harus. Maknanya, it's not haram, and if it gives you a greater good, then they would encourage that. That's one way of doing it. So far I have no issue. I don't go claiming, this one got Hosaina, this one got I don't do that, because for me it's like, if this is giving more benefit, and that's the only choice that you have in terms of protecting the child, there's no issue with that. And I think a lot of parents, they don't ask anymore.
I mean, to answer that, I think there's a book produced by two Malaysian doctors. One is our Malaysian Pediatric Associate Treasurer, Dr. Musa. Controversy Vaccine. There's both in English and Bahasa Malaysia. I think it's titled A Scientific Perspective from Islam. It's very, very clear. Most of the pediatricians have the book in their clinic, and currently in my hospital, I used to give, it's only $1. During MPA conference, we always sell it, and it's mainly that it's a charitable thing. It goes back, and then most of my MOs have the book in the clinic. You know, often when those days when we use it, often actually it is still available. Apart from that, there's one recent paper in 2019. Again, I was in Kuantan for a long time, and UIA, my colleagues there, they have a lot of papers. One from the Kuliah of Pharmacy, again on talking about all the Sharia and the Fatwa. The paper is very clear for both the policymakers, the manufacturers. I think I'll share with you the paper. It's very clear that. Apart from that, in Malaysia, we have certain platforms that to advocate vaccination and immunization. One is a collaborative effort by Ministry of Health, Malaysian Pediatric Association, Malaysian Society of Infectious Disease and Chemotherapy. It's called Immunize for Life, actually. Everyone is welcome to go in there and have a look at that. There it talks not only for vaccination for children, but also for adult vaccination. And I take this opportunity to say that we just celebrated our International Immunization Week, which often the last week of April, 24th of April to 30th April. And this year's theme for the international team, every pediatrician of the societies we are talking about, is a big catch-up campaign. Because as Dr. Sharifah spoke earlier, usually about 200 million children worldwide will miss the vaccination, especially from the sub-Saharan African countries, especially. That is there because of the cost of it actually. And after the pandemic, it went up to 250 million, about 81%. So the idea is now to get this up, and IPA is on that. On the same topic, I would encourage the participants to go into IPA, International Pediatric Association website. There's something called Global Vaccine Trust. Our colleague Dr. Naveen started it, and it is on, there's 7 modules on how to tackle vaccine hesitancy. It's very, you can do an online course, and they will give you an online certificate. I have joined it during the last 1 year. That's something very important. I think everyone It is open for all pediatricians, and you can just go in as a QR code, you scan, and then you can go to the web. It's a module on video. Thank you. Any questions, Dr. Sharifah? Yes.
It's a very interesting topic, and you have brought it up towards the end, how you are getting to the public.
May I know if you can introduce yourself? It would be good.
My name is L.A.M.
Oh, yeah.
Something wrong with your name, no?
No, nothing. I just want to make so everyone can understand.
I'm from UITM, Alam, Faculty of Pharmacy. This is a very topic to me, at the bottom of my heart, and I don't want to have a debate. Just want to go at what Sharifah have said and what you have said. What the Malaysian Pediatric Association is doing is good, but they are not going the other platforms they have. They are not going to the root of the problem. If, for example, when hepatitis B was introduced in the country somewhere in 1990 or 89, there was a lot of resistance against getting this hepatitis vaccine. We had societies like what you say, the Malaysian Infectious Society, the Malaysian Health Society. They got some funding from the Ministry of Health to go to each of these places and promote and explain to them the material, whether it is a mosque or a temple or a place of any worship, where there are people who really require that, they will go to the deep roots. And what Chairman here have said that will be only applicable to professionals, but you won't go to the down root. See, for example, some years back in 1990, when the Malaysian Ministry ordered Japanese encephalitis vaccine, it was real a waste. And we were a group of people who were saying, and the group of people were the veterinarians, that these vaccines is not used for this country, and we are going against a different diagnosis. Anyway, let me put that a different issue. Now, coming to this vaccination, since 1950 we say we have about 15 vaccines. We don't have a very good vaccination book in this country. In the very beginning, we used the birth certificate. They used the chalk and say that these vaccines are done from birth, from the BCG, etc., etc. And then there was a debate that this birth certificate belongs to the different part of the government, that nobody should endorse that. So if we were to have a vaccination book that may help in the vaccination program, people may have the confidence.
We actually have.
Yeah.
It's very thick book.
No, for the patients.
For the patient to keep.
we have.
It's a thick book that the patient keep. We have all the immunization schedule, and they will sign and all that. And inside we have our growth charts. We have information about development, even questionnaire to screen for autism. It's all there in that big book. And they will need to actually, before they register for schooling, for primary school, they will have it in their hand because it belongs to them.
I think there's a test. It's called home-based book actually. As pink for females, blue for boys. It has been there for almost, I think, 30 years odd now. We have been constantly updating it. I was involved in the second edition. Now the third edition has come out because of we have included the Accessim inside and the pneumococcal vaccine actually. And the moment any Malaysian child born in Malaysia, government hospitals, they are provided with the book actually. And in the book, there's antenatal history, there even you write your D6PD status, T4TA stage, birth weight and everything. And it goes according to weeks where they're supposed to see the health clinic. In Malaysia, it's fantastic. Every 5 kilometers, we have a health clinic actually. And that's why no patients should don't say that they don't have access. And the nurses, as Dr. Sharifah said, the JMs, even before that, they do home visit. Of course, the vaccination is done in the hospital. If they miss it, they are reminded to attend. And now, if you heard that we have My Sejahtera and there's one called My Vas, we are already embarking on that hopefully we can get the books as you said, human beings, some of the parents might lose it, but we constantly tell them that they must keep the books. Even if the child gets admitted to the hospital, if I'm doing the rounds, first thing I'll see is the book, and I will make sure that the central charts are plotted very well, and also the vaccination. But that is in practice. In fact, I'm proud to say, among the Southeast Asian countries, Malaysia has a better, robust system than compared to any other countries actually. That's one thing. Okay, the private hospitals are encouraged to use the book, but some private hospitals, they have their own,
create our own book.
their own book, and they have the same schedule in there actually. And some of our patients, even though delivered in the government hospital, they can carry the book, and the private pediatricians can enter the data in there. Come again? Oh, we're no longer doing birth certificate. I'm one of those guys who's only in the birth certificate, yeah. Then you went on my age actually. But right now, everyone actually. And to answer to the other question, I'm a proponent of, I'm a pediatrician, I must talk about vaccine, and vaccine preventable disease is my goal. And I'm also a Rotarian, we go around talking about polio. I always show my colleagues who are non-medical person a picture of smallpox. Those born, I think, by 1979, those after 1979, you won't have two scars here. One for BCG and the other for a smallpox. Smallpox, I always tell smallpox killed 340 million people, blinded a lot of them. And the vaccine is effective is because we have done our job. The next on the road is polio. And we have done a good job. It's only 2 countries. Now this is another way of talking to non-medical people of the goodness of vaccine and why should we. As Dr. Ajit said, the reason for cost in Malaysia is not. We have a beautiful, whoever comes in, but the establishment has been done from 1950s. All vaccines are provided free for Malaysians actually. In fact, the hexacin, I'm from Ministry of Health, the hexacin is also given free to our immigrant children. Of course, the other parts of the vaccine are not. And these are something that we need to talk about. The population of immigrant, some of the NGOs are helping to vaccinate these children, especially certain diseases. So we often ask whether the NGOs, UNICEF comes in, UNHCR, these pockets of unimmunized or unvaccinated population are the ones that will cause a threat to us. And it has been seen clearly in 2019 when there was a scare in Sabah, polio, and it's because of the unvaccinated population in that area. So often we go and do mopping up. From Ministry of Health, the public health sector, the moment we report, there will be a mopping up exercise. And we did a good job of mopping up in Sabah, and by the following few months, we were certified again polio free actually. That's something that excellent we've been doing. Thank you. Anything else?
No, I have nothing else.
One more question, sorry.
Yeah,
it's okay. I think the KM is doing a fantastic job with vaccination, but what I'm a bit concerned is that how this information is being passed through social media. Okay, see, in Pantai Hospital where I work, we do see a lot of patients that comes in for natural birthday, and they are now thinking about delivering at home. And these are things that are going around in social media, which I think that needs to be addressed too. Honestly, this group of parents are well read. They are intelligent. They have done their research, and it takes you yonks to even convince them to take the vaccination. And they've come with a preformed idea that they do not want to be vaccinated, and it's difficult. So I'm sure you've seen this group of children, parents in your clinic before.
Yeah.
There's no way you can change their mind because they have already fixated. It's like a fanaticism over something that's against vaccine. But where does it begin? It begins in the social media group. I can name you a few social media groups such as Gentle Birthing. These are groups that are going around telling, sort of encouraging people not to vaccinate. And I think it's about time that KKM looks into how can we move on to social media to give our information. People don't read anymore. People don't read pamphlets anymore. People don't listen to news perhaps. So then now they look at things like TikTok, they look at things like social media, Instagram. And this is where we have to now change our mindset so that we move on to this platform. It's not about the cost of the vaccine. Like I said, we are fantastic. We can get vaccination for free. There's no reason that. And yet we see this group of children coming up and they're getting more and more. And I think it's unless we now look into how we can tackle this intelligent group of people who are very well learned and they get the information through this group of social media, then we are going to miss the whole mechanism of stopping. The other aspect, if we are very firm in our stand with regards to vaccination, one of the best ways to stop them is to make it compulsory for them to bring their children to school or even to daycare for them to be vaccinated. Because I've got a child that refuses vaccination. The only reason why they came on to be vaccinated was because the child wanted to be in the international school and it's a requirement for them to get all this vaccine. So if KKM is really stern about it, this is a step that we have to move forward. Are we firm enough to say that vaccination must be given to all children in order for them to attend daycare or school? So this is my advice.
Sharifah, you want to address that?
Well, I'm with him.
I know, contentious issue, but I mean, in my clinic, Ministry of Health, I seldom to come this because the area that we serve, but these are the high, yes, they come to you all. But we have I call him the rock star of vaccine, Dr. Musa. I mean, he always, I think he comes out in video and everything. The last one that we did, he said, in fact, you say 5 C's, he said 3 C's. Confident that we as healthcare providers, professionals, we must be confident when we are talking to these people. Of course, as you say, there are certain areas we shouldn't be going there because then it's going to be difficult. Number 2 is convenient. Talking about convenience, the vaccines now are much more convenient compared to our time. Multiple shots and less. And the other one is complacent. Complacent, he always says, peka dan leka. So itu yang masalahnya jadi. So I think we should, I agree. The social media platform is, and I'm not into that. I think nowadays, that's why Immunize for Life, if you go, we are doing, that is part from MPA and Ministry of Health. We are doing, of course we can do more. I will echo your thing to the bahagian PTKK and we'll see. Thank you.
Well, I would want to add on to that. I think when you talk about social media, they have a way on how to touch the people. Yes. So our method on social media doesn't seem to appeal to them.
Exactly.
So hence some of our colleagues actually are TikTokers now, but there are very few of them who want to do that, I know.
You need young people like Azam.
Alright, thank you.
On top of that, I do take chances if I meet my colleagues who are non-medical people, my family, anyone has a new child and a baby, I always tell them, revisit vaccine scan and tell them that how that back in 1950s, those days, how we had to go very far to get vaccines actually. The injections and the nurses had come. But now it is very, very convenient, and the most important thing in Malaysia is free. If you go to any government facility, you are given free. They will never ask you what is your job, they will give it free. So that's the most important thing. I think cost is never an issue here. Of course, a certain part of the Islamic values and everything, but there's a lot of new papers written and everything, and the books. I think again they can tackle that. The only thing is that the new people who are this so-called, there's something called misinformation and disinformation. Two different things. Thank you. Thank you, Sharifah. I think